I was recently asked, should I be concerned if I have elevated LDL, more specifically LDL-C? Hi, I'm Dr. Ron Rigby. Today we're going to talk about cholesterol. One aspect of cholesterol, the LDL, or the low dense lipoprotein. It's not as simple as good and bad as we always make it out to be. There's not just one type of LDL, there's multiple types. There's at least 7, so I could be off a little bit, but there's multiple different types. And they can be big fluffy ones that can be floating in your bloodstream, or they can be small irritating bouncing along your bloodstream. So how do you determine if they're big fluffy or floating or small irritating could cause some problems? Without doing more blood work would be take your triglycerides. Some labs will say 200, some will say 150. 75 is better than 150. Lower the better on the triglyceride. Divided by your HDL. Goal for a male is above 40. Goal for a female is above 50. Higher the better. If that ratio is less than 2, some of us would argue less than 1.5, but at least less than 2, then they're the big fluffy ones which are floating around, which are carrying more molecules, which is better. If they're greater than 4, they're the small irritating ones which can actually cause some problems. When your doctor says, oh, your LDL is high, we need to go a lot deeper. What's my triglyceride? What's my HDL? Because that has shown to be more of a risk factor than just your LDL. In fact, when you look at metabolic syndrome, it's a major problem that most of us have. I've heard anywhere between greater than 60 and as high as mid 80% of us have some type of metabolic syndrome issues. They don't even list LDL as one of your issues. If we want more in-depth blood work, we need to do a lipoprotein or an NMR, looking at all the little characteristics and the size of it. When your doctor says, oh, your LDL's high, here's a prescription, let's go ask a little bit farther. Let's go dig deeper. Just lowering your LDL doesn't always solve the problem. We need to change your ratio of your triglyceride to your HDL. We can do that by lowering your insulin. Medicines that can help us lower your insulin can help, but if we're not doing the things to try to work on lifestyle to lower your LDL, we're not solving that problem. The human body is not simple, so keep that in mind. Thyroid not in a good place could also play another role in affecting your cholesterol overall. Hopefully this was helpful. Again, it's not as simple as, should I be concerned if my LDL is high? Maybe, maybe not. Depends on the ratio. Our goal is to optimize lasting weight loss through metabolic healing. We're trying to heal you from the inside out. We've got to try to get the cells functioning better. This is a journey, not a sprint. We're here to help you.